Darren is the Director of the Sexual Health Clinic at the Cairns Base Hospital. He holds positions of Clinical Associate Professor in the Department of Population Health at the Uni of Melbourne, is an Adjunct Professor in the School of Medicine and Dentistry at James Cook Uni, has been the past President of the Australian Chapter of Sexual Health Medicine for the Royal Australian College of General Physicians, and has interest in men's health, Indigenous sexual health, HIV and AIDS, genital herpes infections. Darren has been involved in clinical and epidemiological research and is the co-editor of the textbook Sexual Health Medicine and a joint author of Talking with Clients About Sex. He has worked in the field of sexual health and HIV medicine for 20 years.
I'm going to talk about three things tonight: HIV prevention, a little bit about ageing, and a little bit about the search for a cure. So the first thing I'll talk about is HIV prevention and what we call the prevention revolution now, because there's been these very exciting things in HIV prevention. And it might seem a bit odd that I'm talking to a POS audience about prevention. Might be a bit late for that for some people, but what we really want to do is to teach as many people as possible about this, and we think that POS guys and girls are really important to get the message out and to know about this, because there's some stuff that POS people can do as well. There's been a big push in the last couple of years to really do something about driving HIV rates down in the world. Apart from condoms, we didn't have a lot else we could do until a few years ago. But now we are starting to see a real drop in the number of HIV cases and new infections in many parts of the world, particularly Africa, where the numbers are huge. And the politicians have got behind this because it's all very sexy. You know, you can go for an AIDS-free generation and come up with all these great talking points that sound good, but they are perhaps possible. So this is the whole idea about HIV prevention now, that we really try to mobilise communities, educate, get people moving, and encourage widespread HIV testing. It's hard to prevent passing HIV on if you don't know you've got HIV in the first place. So what we want to do is to find as many people as possible who've got HIV, both for their own health, but also so they can do something about not passing it on. So a lot more testing. And then for those without HIV, really accessing some of the new prevention strategies and devices, and I'll talk about that. And some of the old devices, which are condoms, of course. For those with HIV, it's about accessing care and treatment too. So, what are we doing now with HIV prevention? Well, the new stuff is about rapid testing, and we've rolled this out in Queensland, and then New South Wales is doing it, and one clinic in Victoria so far, but others are going to line up for that. These rapid tests have been available throughout the world for a long time, but Australia only approved them in December last year. And basically they're just like a little pregnancy test kit. You just drop a drop of blood onto one end of the strip, you wait 20 minutes and you get an answer. Yes, there's HIV, no, there's not. Now, not everyone wants to have a rapid test, but for some people, they find that a really cool way of getting a result. It's something a bit new. It also means they can drop in, get the test right at the time. They don't have to wait for a doctor or nurse to call them back a day or a week later. So it might help us to find a lot more people with HIV. There's something I'll talk about called treatment as prevention, and many of you might have heard of this. It's people go on treatment and reduce their viral load, and it makes it much harder to pass HIV on. So I'll talk about that a bit more. There's PrEP, or pre-exposure prophylaxis, and PrEP isn't available in Australia yet, but probably will be early next year. It's been licensed for use in America using the drug Truvada, which Fiona talked about. And so I'll mention a bit more about that coming up. And of course, post-exposure prophylaxis, or PEP, which we have had for a long time. And this is if someone's HIV neg and they've been exposed to a possible risk, then if they take medication within 72 hours, within 3 days, they greatly reduce their risk of contracting HIV. So we have rapid testing, treatment as prevention, PrEP and PEP. And this is the sort of new prevention revolution stuff that's happening. So what is treatment as prevention? Well, the antiviral drugs, as you know, get the amount of virus in the system down, which is great for the person who's got HIV. But the really good thing is that it virtually, not totally, but virtually eliminates HIV from semen and vaginal fluids and stuff like that too. So it means that if someone's having sex, they're far less likely to pass it on. And the chance of HIV being passed on sexually becomes very, very small indeed, which is great. So the treatments are great for the health of the individual, but they're also great for not passing on the virus, which is also good for the health of that person in terms of their mental health and perhaps feeling good about themselves and their sex life too. So in New South Wales and now in Queensland, what we're aiming to do is to get about 90%, that's the figure we think we need, about 90% of people with HIV onto treatments. And this is, we think if we can get up to this number, then there'll be so little virus floating around out there that the risk of passing it on becomes much less. Now, this isn't anything about forcing people to go on treatment or anything like that, but it's really letting people know about treatment so they can make the decision as to whether it's right for them. Now, some people aren't going to want to go on treatment, and that's fine. Some people don't need to go on treatment, that's fine. Some people aren't sexually active, or they're only sexually active with someone else who's got HIV, so they're not going to pass it on. So this whole idea isn't really relevant for them. But for a lot of other people who are sexually active, it's a very important thing. And at the moment, we take too long from someone getting HIV to actually getting on treatment. In Australia, it's about 4.5 years, and that's probably far too long. We should be aiming to have that much shorter. And if we do that, then there's much less virus floating around in the community, which means it's much less likely that we get more infections in the future. But 90% on treatment, what have we got in Brisbane at the moment? Well, it's probably 65, 70%, maybe best estimate 75% of people on treatment. So we've got a little way to go to get up to 90%. Of course, people have to find out they've got HIV first. You know, if you don't know you've got HIV, you can't go on treatment. So that's the first step. Then they've got to be able to get to a doctor. Fortunately, in Brisbane, there's lots of good doctors. Doctors need to be wanting to prescribe treatments early, and this is still a little controversial. Some doctors are very keen to get people on treatments, and others aren't so sure about it and are holding back a bit. So we've got to get the doctors and nurses alongside with us here. People have to be able to afford treatment. It's no good if we prescribe these things and people can't afford it because they're too expensive, and there are real barriers to people going and picking up their medications and being able to afford them every month or two. And the federal government says we shouldn't start some people on treatment unless their CD4 counts dropped a bit. So we've got to do something about that as well, but we'll get there. So how are we going to overcome these barriers? We've got to test, and test. We've got to find more people with HIV so we can offer them treatment if they want to go on it. We need to educate people who are living with HIV about treatments and what they're all about so they can make up their minds for themselves. And we've got to get the doctors on board as well doing all this. Okay, so that was treatment as prevention. Then there's PrEP. And of course, all these ads always feature hunky guys. So here we have be prepared. So instead of holding a condom, he's holding one little tablet there. And this would be a tablet of Truvada, which Fiona spoke about before. And PrEP is for someone without HIV. So they're HIV negative, but they take one pill a day to prevent getting HIV. Now this sounds a bit weird, but if you told women in the 1950s they could take one pill a day to stop themselves getting pregnant, they would have thought that was a pretty weird thing too. So it's a very new concept, but it's been shown in some studies to work well. So the drug that's been licensed in America for this is Truvada, which is tenofovir and FTC in one. Very few side effects, particularly for people without HIV for some strange reason. But there's another drug that's being trialled in America called Maraviroc, which is the entry inhibitor that Fiona mentioned before. So that's great, but does it work? Well, there was a big study of gay men around the world, and the study showed that it was over 90% effective if people took the medication at all. So not 100% effective, but 90%. It was closer to 99% effective if people took the tablet every single day. But if they started forgetting tablets here and there, it wasn't as good. Strangely enough, it didn't work if the guys didn't take the tablets. Okay, So it's no good sitting on the bedside table or in your sock drawer or in your cabinet there. It doesn't work. You've got to actually take the tablets. And this is one of the problems. You know, will guys take the tablet every day? So it is approved for use in the United States for this, but not in Australia yet. We've been lucky to get some money up in Cairns, and we're going to get somewhere between 20 and 50 guys in Queensland, so it's not just in Cairns, but across the state. And we're going to try and find guys who are at quite high risk of contracting HIV. These are guys who have unprotected sex with a POS partner, or have unprotected sex with casual partners and they don't know their status. So if guys are really good at using condoms all the time and love using condoms, this isn't going to be for them. This is for guys who don't like using condoms, have trouble using condoms, forget to use condoms, can't be bothered to use condoms, can't fit into condoms, whatever. We're going to be offering this to them as some sort of a study. And we're going to be looking for general practitioners and clinics around the state to offer this to guys in the future. So it's not for POS guys, it's for neg guys, but it's a way of keeping them HIV neg. So this is PrEP. We're going to be getting the information out, and we hope early next year to be, well, probably April, May next year, we're hoping to start. It's got to go through a lot of hurdles first to get there, but we're hoping to be able to make it available to guys. It'll be free for a 12-month period to see if they're able to take it and how they go with it. And we'll be monitoring them during that time. So what would we like for PrEP in the future? Well, it'd be great if it got approved for usage, and the company that makes the drug might try and get it approved. The big problem is going to be funding. Who pays for this drug? You know, $600, $800 a month, who's going to pay for it? Obviously not everyone can do that, so we're going to have to get government to pay for this for some people. But who do they fund it for? Just some people, for anyone who wants it, or only high risk? How do we decide? So this has all got to be worked out. And then hopefully in the future there's a choice of medication. So if people don't want to take Truvada, they can take Maraviroc or one of the other drugs. And maybe even that 1 monthly injection that Fiona mentioned before. So you could have an injection once a month to lower your chance of catching HIV. At the moment, the studies have mainly said you've got to take it every day, but we don't exactly know. Maybe you only have to take it you know, a few days before you have sex and a few days afterwards, but we don't know. So if you're heading down to Mardi Gras or something, you know, can you just take it a few days beforehand, during Mardi Gras, and a few days afterwards? We don't actually know yet if that's going to protect people enough. So we need more studies to let us know if it's going to work that way. You know, you just pop it now if you've got to have sex tonight, or do you need to have it more? Probably need to have it 2 or 3 days in advance, we think, for it to work properly. And this is all part of our campaign. You've got the bags around there, the End HIV campaign in Queensland. So it's all about trying to reduce transmissions to other people. So that's all about prevention. Let's move on to ageing. This is the vintage people here. It's fun to be an OAP, which is old age pensioner. So I'm sort of old enough to remember the village people, I think. Actually, I am. I'm definitely old enough to remember the village people. I'll just talk a little bit about ageing. And what we're finding now, of course, is that in many parts of the world, particularly the developed countries and wealthy countries, maybe over half of people with HIV are over the age of 50 now. You know, when I started 20 years ago, it was mainly young guys getting HIV, but of course those young guys, like me, are getting older. So there's this effect where people are just aging with the virus. But there's a few challenges for people who are getting older with HIV. People get other medical conditions as they get older. We sort of get high blood pressure and high cholesterol and heart problems and all those sort of other things just as we get older. Arthritis, joint problems. And because we get other medical conditions, we end up going on other treatments. We've got a tablet to lower our blood pressure, and a tablet for cholesterol, and a tablet for gout, and a tablet for this and that. And some of those medications can interact or have problems with our HIV meds, so that's an issue. There can be a loss of support for people as they age. People may leave their jobs and retire. They don't have that support. There can be problems with friends passing away as they get older as well. Changing roles as people get older. For example, caring for aging parents. You move from being, a young man out in the scene to a middle-aged man to an old man who's actually looking after elderly parents perhaps. And that can be a bit of a challenge for people to get their head around. And difficulty adjusting. I know in the early days, a lot of people with HIV didn't expect to live very long. Some of them sold up their house or took out their superannuation and then ended up not having much left. And then suddenly we're getting older. And some people left their jobs and just have to go back to work now. So there's all these changes that occur. So for those who are facing ageing, what should you do? Well, I think it's really important, and we're lucky here in Queensland to have good doctors who know about HIV. So you need an HIV doctor. But it's also good to have a general practitioner who can do the other medical care. If you're lucky enough to see Fiona, you've got both in one. But some hospital clinics and some sexual health clinics may not do the general practice work, so you really need to find a good GP for some of that other medical care. If you're going on new medications, do talk to your doctor and your pharmacist about them. They can interact sometimes with the HIV medications, particularly the protease inhibitors, ritonavir, Kaletra, darunavir, those sort of drugs. As we get older, it's important to look at our lifestyle, keep up some sort of exercise, whatever that is, eating well, looking at smoking and drinking habits, get support, get help if you need it. And that's where organisations like QPP can be really, really helpful for people as they age too. And what about the cure? Some of you might have heard of steps to try and find a cure for HIV. And this was the first man in the world to be cured of HIV. His name was Tim Brown, and he was also known as the Berlin patient because he's an American guy living in Berlin. And he's either very unlucky or very lucky, depending which way you look at it. Why would he be unlucky if he's got rid of HIV? Well, he had HIV, and then unfortunately he got leukemia, which had nothing to do with HIV, he just happened to get leukemia. They treated his leukemia, that was great. And then unfortunately the leukemia came back. So when leukemia comes back, the usual treatment is a bone marrow transplant. And that's a very risky thing. About a third of people with leukemia will die of a bone marrow transplant because what the doctors have to do is wipe out their immune system so that somebody else's blood cells can be injected into the person and then grow and take over. If they don't get rid of the person's immune system, then that person's immune system will just destroy those red blood cells from someone else. So that's why it's so risky. Well, they did that with Tim Brown, and he survived and did really well, but then they couldn't find any trace of his HIV, which was a bit weird. In wiping out his immune system and giving him someone else's immune system, they actually had got rid of his HIV. And he's been incredibly good. He's let them take samples and specimens and biopsies from just about anywhere that the doctors can. Anywhere they can reach, they've taken specimens, and they can't find any virus left in him at all. So he's been sort of a miracle patient. And this was discovered a few years ago. So what it's meant, before that we didn't think it was probably going to be possible to cure HIV for a very long time, but because this happened, it showed that it was possible. Not easy, maybe a fluke, dangerous, risky, expensive, but possible. So, as I said, he had a stem cell transplant, a bone marrow transplant, and since then 2 other people in the United States in Boston have also cleared their HIV as well, as far as they know. So it doesn't seem to work with everyone who gets a bone marrow transplant, but it does work with some. And all of these guys are all off their antiviral treatment and there's no sign of the HIV. What else? Well, gene therapies. We all hear about gene therapies and stuff like this. It's very space age, very sexy, very exciting, but so far hasn't delivered much. It promises a lot, but doesn't deliver yet. Very expensive, so this is not going to be available in Africa or most of Asia. This gets a bit complicated, but one approach protects the T cells by knocking out something called the CCR5 receptor. Now this receptor is on on the surface of T cells, and it's how HIV gets in. So if you think of this receptor as like a lock, and the HIV virus is the key to get in, what they've done is take cells, T cells, out of someone, genetically modified them so they no longer have a lock, they no longer have a keyhole there. Which means that when they put these cells back into that same person, the virus can't get into the T cell because there's nowhere for it to get in. So this has been tried in the United States, and what they've found in some people that they've done it with is that the amount of virus in their system drops dramatically. No one's been cured yet, but some people have dropped virus dramatically without any other treatment. But other people, it doesn't seem to have worked. So now they're trying to figure out, why does it work with that person and not with that person? But it's exciting. The most recent thing, and this was just announced a few weeks ago, is a vaccine. Now normally if you think of vaccines, you give someone a vaccine to prevent them getting some sort of infection like hepatitis or chickenpox or German measles or something like that, the flu. But it's possible that vaccines could treat infections as well as prevent them. Now this hasn't really happened much yet, but they are looking at it. And just recently a researcher in the US made a vaccine against SIV, simian immunodeficiency virus. So certain monkeys can get HIV, except they call it SIV, slightly different virus. And it allowed these macaque monkeys to clear the virus. And this has never happened before. So they gave them this vaccine, and the amount of virus dropped down in the monkeys and then disappeared. Not all the monkeys, but some of the monkeys. So this is the wrong species and the wrong virus, but it was very exciting because they didn't think this was possible. If a monkey gets SIV, it doesn't get rid of it ever, just like humans don't get rid of HIV, but these monkeys did. So the next step is, can they make something similar that will do the same in humans for HIV? So this is very early days, but quite exciting as well. So there are three approaches to cures. There's stem cell transplant or bone marrow transplant, genetic engineering stuff, and a special type of vaccine.